Welcome to our video on kidney stones. If you've ever experienced a kidney stone or know someone who has, you know how painful and distressing they can be. In this video, we're going to break down everything you need to know about kidney stones, from what they are, to how they form, to what you can do to prevent them. Whether you're here to learn how to avoid kidney stones or just want to understand more about this common condition, we've got you covered. So let's get started by understanding what kidney stones actually are. Section 1. What are kidney stones? Kidney stones are hard, stone-like formations that develop in your kidneys. These stones are made of minerals and salts that usually dissolve in your urine. However, when your urine becomes too concentrated, meaning there's not enough fluid and too many waste products, these substances can crystallize and clump together, forming a stone. There are different types of kidney stones, and they're classified based on what they're made of. The most common type is calcium stones, which are primarily composed of calcium oxalate. Other types include uric acid stones, which form when your urine is too acidic, and struvite stones, which are often related to urinary tract infections. There are also cystine stones, which are rare and usually result from a genetic disorder. So why do kidney stones form in the first place? The formation of kidney stones can be influenced by a variety of factors, including your diet, fluid intake, and genetics. If your diet is high in certain substances like salt or oxalate-rich foods, or if you don't drink enough water, your risk of developing kidney stones increases. But diet and hydration aren't the only factors at play. Some people are simply more prone to developing kidney stones due to their genetics. If you have a family history of kidney stones, you're more likely to develop them yourself. Now that we know what kidney stones are and why they form, let's talk about how you can tell if you have one. Section 2. Recognizing the symptoms of kidney stones. The symptoms of kidney stones can vary depending on the size and location of the stone. Sometimes, small stones pass through your urinary tract without causing any symptoms at all. But when a stone is large enough to block the flow of urine, or when it moves into a narrow part of the urinary tract, it can cause severe pain and discomfort. One of the most common symptoms of a kidney stone is sharp, cramping pain in your back or side, just below your ribs. This pain can radiate to your lower abdomen or groin as the stone moves through your urinary tract. The pain often comes in waves and can be intense enough to send you to the emergency room. In addition to pain, you might notice other symptoms, such as blood in your urine, which can make your urine appear pink, red, or brown, cloudy or foul-smelling urine, a frequent need to urinate, or pain while urinating, nausea and vomiting, especially if the pain is severe, fever and chills, which could indicate an infection in your urinary tract. If you experience any of these symptoms, it's important to seek medical attention right away. While some kidney stones can pass on their own, others may require treatment to remove or break up the stone. Section 3. Diagnosing and treating kidney stones. If your doctor suspects that you have a kidney stone, they will likely start with a physical examination and ask about your symptoms. To confirm the diagnosis, your doctor may order imaging tests, such as an ultrasound or a CT scan. These tests can help locate the stone and determine its size and shape. In some cases, your doctor may also request a urine test to check for signs of infection or to measure the levels of certain substances that contribute to stone formation. Blood tests can also be helpful in identifying underlying conditions, such as high levels of calcium or uric acid, that might be contributing to your kidney stones. Once a kidney stone is diagnosed, the next step is determining the best treatment approach. The treatment for kidney stones depends on several factors, including the size, type, and location of the stone, as well as the severity of your symptoms. For small stones that are likely to pass on their own, your doctor may recommend conservative management. This usually involves drinking plenty of water to help flush the stone out of your urinary tract. Your doctor may also prescribe pain relievers to manage discomfort and medications that help relax the muscles in your ureter, making it easier for the stone to pass. If the stone is too large to pass on its own, or if it's causing severe symptoms, more invasive treatments may be necessary. One common procedure is extracorporeal shockwave lithotripsy, ESWL, which uses sound waves to break the stone into smaller pieces that can be passed more easily. Another option is ureteroscopy, where a small scope is inserted through your urethra and bladder to locate and remove the stone. In some cases, a laser is used to break the stone into smaller fragments. For particularly large or complicated stones, surgery may be required to remove the stone directly from the kidney. Section 4. Preventing kidney stones. Now that we've covered what kidney stones are, their symptoms, and treatment options, let's talk about prevention. The good news is that there are several steps you can take to reduce your risk of developing kidney stones in the future. First and foremost, staying hydrated is key. Drinking plenty of water helps dilute your urine, which reduces the concentration of minerals and salts that can form stones. Aim to drink at least 8 to 10 glasses of water a day, and even more if you live in a hot climate or engage in intense physical activity. Diet also plays a crucial role in kidney stone prevention. If you're prone to calcium stones, your doctor may advise you to limit foods high in oxalates, such as spinach, nuts, and chocolate. However, it's important not to cut out calcium entirely, as this can actually increase your risk of kidney stones. Instead, focus on getting calcium from dietary sources like dairy products, and pair them with oxalate-containing foods to reduce the likelihood of stone formation. For those at risk of uric acid stones, reducing your intake of high purine foods, such as red meat, organ meats, and shellfish, can help. Additionally, staying away from excessive amounts of salt and sugar, particularly from sugary drinks, can further reduce your risk. In some cases, your doctor may prescribe medications to help prevent kidney stones. For example, if you have a history of calcium stones, you might be prescribed a thiazide diuretic to help reduce the amount of calcium in your urine. If you're prone to uric acid stones, medications that lower your urine's acidity might be recommended. Section 5. Living with kidney stones. Living with kidney stones can be challenging, especially if you've experienced multiple episodes or have a chronic condition that makes you more susceptible to stone formation. You're not alone. Many well-known celebrities have dealt with kidney stones, including actor William Shatner, singer Harry Styles, comedian Ricky Gervais, actor George Clooney, and even pop star Britney Spears. These experiences highlight that kidney stones can affect anyone, regardless of their lifestyle or status. However, with the right strategies and support, it's possible to manage your condition and reduce the impact it has on your life. One of the most important things you can do is to be proactive about your health. This means following your doctor's recommendations for hydration, diet, and medication, and staying vigilant for any signs of a kidney stone. Regular checkups with your healthcare provider can also help catch any potential problems early before they become more serious. William Shatner, for instance, has spoken about his commitment to staying hydrated and making dietary changes to prevent future stones. Support from family and friends is also crucial when dealing with kidney stones. If you're going through a particularly painful episode, having someone to help with daily tasks or provide emotional support can make a big difference. When Harry Styles had a kidney stone while touring, he relied on his support network, including his bandmates, to get through the tough times. Don't hesitate to reach out to others for help when you need it. Finally, it's important to remember that while kidney stones can be painful and disruptive, they are treatable. Advances in medical technology have made it easier than ever to diagnose and treat kidney stones, and with the right care, most people recover fully. George Clooney, who experienced a painful episode while filming, managed to get back on his feet quickly thanks to prompt medical treatment and good follow-up care. The same goes for Britney Spears, who has been open about her struggles with kidney stones and the relief she found through proper treatment. These examples show that while kidney stones can be a significant health challenge, they don't have to hold you back. By being proactive, seeking support, and following medical advice, you can effectively manage kidney stones and continue to lead a full and active life. Conclusion: kidney stones are a common but painful condition that can affect anyone. By understanding what kidney stones are, how they form, and what you can do to prevent them, you can take control of your health and reduce your risk of future stones. Thank you for watching this video.